Okay, so hello everyone, I'm Alice from Welldoing, and to celebrate Welldoing's 10th anniversary, we have launched the Welldoing Inspiration Awards to recognise businesses, people, organisations and brands that have been doing inspiring work in the area of mental health and wellbeing since we launched. So today I'm really excited to be speaking with Andrea Burroughs, who has nominated the CEO and founder of CardMedic, Rachael Grimaldi. So thank you so much both for coming. And Andrea, over to you first as the nominator. So you are the Associate Commercial Director at University Hospitals Sussex, I believe. So can you tell us a little bit about that role and what's involved?
I am, yes. So thank you. Yes, I'm delighted to be here today. So I am the Associate Commercial Director at University Hospitals Sussex. Bit of context. So we are a big hospital serving the population of Sussex and a little bit beyond as well. We've got 7 hospitals across 5 different locations. We employ 20,000 staff. So we're a big, and my role is has a number of different aspects to it. It's partly in terms of working with innovators such as Rachael, in terms of helping them secure the adoption of innovation within the NHS, as well as wider aspects of the Trust's commercial portfolio. So that's everything from our retail restaurant offer, what is our commercial strategy, how might we most effectively work with industry or academic partners as well. So it's a really interesting.
Great. And in amongst all of that, how high priority is the mental health of the NHS users in terms of your team's decision making?
Well, so mental and emotional well-being is something that's really important, both to a big employer, such as University Hospitals Sussex, with all the people that we serve, but also the population that we serve. Mental health is an issue that we see too often in the patients that come, to us as a big acute hospital. And obviously, there are a lot of issues. We have to work really closely with our partners in terms of making sure that we support them appropriately. In terms of what we can offer our staff, and that varies everything from meditation to counselling, listening services, and so on. But I think there's a real place for innovation in terms of being able to support mental health and wellness, whether that's for staff or patients or visitors.
Thank you. And how were you first introduced to Rachael and CardMedic?
So I was aware of CardMedic. So I've been here for 18 months, a little bit before I arrived. So my previous role was at Newcastle Hospitals, where I had a similar sort of role. And it was through Rachael's association with NHS England's Clinical Entrepreneur Programme. I first became aware, and the Clinical Entrepreneur Programme is something that I think there's probably about 900 clinicians and allied health professionals have now passed through this NHS England promotion, which is really supporting people, I would say, with an entrepreneurial, innovative gene in their body, and providing often people with a clinical mindset some space and mentoring and support in terms of helping develop that aspect of them as individuals. So I was aware shortly before arriving here that CardMedic was a really interesting innovation, and I was thinking about it in terms of applicability at Newcastle. Then shortly afterwards, I took up this opportunity at University Hospitals Sussex, and I was delighted to understand that Rachael did part of her training here at University Hospitals Sussex as well. So she's essentially one of our alumni, as well as being alumni of the Clinical Entrepreneur Programme. So one of the first things I did when I arrived in my new role, I think it was actually day 14, was actually I reached out to Rachael, and Rachael, I think, was actually having a different sort of experience in the hospital around that time, which I'm sure she'll elaborate on. But since then, I think we've really moved from strength to strength in terms of being what we call a beacon site for CardMedic. And now CardMedic is at the front line of our interpretation and translation services the support that we provide. But what CardMedic delivers is much beyond that. And I was really struck when I first came across CardMedic in terms of the breadth of its offer and its ability to support patients, and also being able to sort of enable our staff to do a better job, essentially, because they are here to deliver care to our patients. And often it's their inability to communicate really across all the different challenges that might exist, whether that's language, cognitive impairment, or so on. That is a real barrier in terms of preventing the people who deliver care to do the best possible job. So that's why I was really keen to sort of link up with Rachel and find out more.
Thank you so much, Andrea. And Rachel, over to you. Congratulations on your award. We're really thrilled to be giving it to you and CardMedic, because we really see the value in that. I mean, I know that a lot of we have a really wide range of languages spoken by our therapists on the site. I think it's 47 or 49. And we also see a lot of people coming through for reasons of, the impact that their medical situation is having on their mental health. So it's a really good lineup with what we think, with what we see as important. So yeah, congratulations. And can you give us a brief overview of what CardMedic does?
Yeah, absolutely. Well, thank you so much. It's such an honor to receive an award, and particularly from someone who's like yourself, who's working in this space, and your team working in this space, but also to be nominated by Andrea is amazing because of Andrea's background and experience, not just working in the clinical space, but working across big hospital settings, up in Newcastle, down on the South Coast, seeing really wide variety of patient population, and knowing the frontline challenges that staff face when communicating with patients, but also patients face when trying to understand and communicate back with staff, and that there are lots of services available and interpreting services and so on, but there are often gaps in service provision, and patients and staff struggle as a result, and that impacts their experience and their safety, can cause significant increased anxiety, increased mental health issues for patients when they can't communicate with staff, affects compliance with medication, affects length of stay, affects rates of readmission, affects litigation, and so on. So that the impact for patient, staff, healthcare systems and the wider economy is enormous when patients and staff can't communicate. So essentially, CardMedic is there to bridge gaps in service provision, but also to be there as a communication support tool in a wide variety of situations, a wide variety of healthcare settings, ranging from in a helicopter to a hotel room where a community midwife might be seeing a pregnant refugee, into a hospital, whether that's A&E, critical care, operating theatres, on the wards, an outpatient department, primary care, and so on. And it's an app that's designed to reduce health inequalities that arise from communication barriers between staff and patients. And Andrea mentioned language and cognitive impairment. It could also be sensory impairment, like visual difficulties or hearing impairment, or also learning disabilities and literacy issues. So it's an A to Z library of pre-written scripts that replicate common clinical interactions, such as taking a history or explaining a procedure, diagnosis, management, or patient education, and so on. And we have 49 languages, or 50, including British Sign Language. And you can change the scripts into those different languages. You can present them as sign language videos, easy read or read aloud. And there's also an inbuilt speech-to-text translation tool. So all the scripts are written by frontline healthcare and allied healthcare professionals, and it was concept launched in 72 hours during the pandemic. At the very start, I was on maternity leave and ended up stuck abroad in the US for 6 months. And at the beginning, I really wanted to do something to help, and I read an article about someone who couldn't understand staff through PPE. And we thought they must be writing notes on paper. Rather than that, why don't we just create a library of scripts? That's where it began. And it was actually when I was on at Brighton at the time, and my friends and colleagues from Brighton helped with writing some of those initial scripts, some amazing critical care nurses, palliative care nurses, A&E doctors, anaesthetists, and so on. And that's where it started and grew from there. And then, as Andrea said, I'm on the NHS Clinical Entrepreneur Programme and also on the NHS Innovation Accelerator, which are phenomenal programmes for frontline healthcare staff or anyone who works in the NHS. It's open to absolutely anybody. It could be an HR, payroll, wherever. Anyone can apply. And they've actually just launched a patient entrepreneur programme as well, which is really exciting. But yeah, Andrea was really exciting. I was thrilled to get an email from her, and it was actually the day I was giving birth to my 4th child. So I said, would you mind if I put you in touch with someone else on our team when we catch up in a few weeks, which we did. So yeah, that was a really exciting time to connect as well.
Yeah, brilliant. Thank you so much. And what do you see as the main kind of achievements that CardMedic has had so far?
I think sort of starting, from where we were, that it was a very simple idea at the beginning. It was just designed to overcome the PPE communication barrier, and that it was just necessity is the mother of invention. And we saw a problem. We knew that it needed fixing immediately, and we just tried to come up with a very straightforward solution to try and overcome that, and doing that in 72 hours. And then in the first 3 weeks, we had 8,000 users in 50 countries, and it just spread. And then from there, the feedback we were getting was this needs to stay as a solution, because PPE is one thing, but actually there's huge issues with language barriers and all the other communication barriers we mentioned. And so I think just growing from that initial idea to where we are now, which is in nearly 30 hospitals, part of 2 accelerator programs run by NHS England, and we've done one in the or 2 in the US actually, through Texas Medical Center and Mass Challenge. And I think the experience and the network that's grown from that, and something I'm really proud of, is the network of like-minded individuals that have come together through this, whether it's speech and language therapists and learning disability nurses, or whether it's midwives that specialise in health inequalities, or frontline staff that, like digital midwives that we work with, are phenomenal, and they're so passionate about improving maternity care, which is where we've had a lot of uptake in maternity and neonatal. So I just think just that, seeing the actual impact on frontline staff and patients, and I use it myself in practice as well. I think that it's actually gone from that to something that's in the hands of staff and patients and actually making a difference on the front line, and the network of people that have grown as a result of it, and that I've put in touch with each other, and the relationships that have come out of that, and the passion that's grown out of that, it's so rewarding. And it's something that I never planned on doing or anticipated. I'm, still in training, nearly at the end. I've been in training a very long time now, doing fellowships and less than full time. And so, I never saw this as part of my journey as a junior doctor, although I have been a junior doctor for over 15 years. So yeah, I think it's definitely a really exciting journey and a really exciting opportunity that's happened as a result of this. And so, yeah, something I'm very proud of.
Yeah, absolutely. You should be.
Thank you. Wonderful. It's been a big team. What I will say is it's a huge team effort. And there's absolutely no way I could have done it on my own. It was my husband and I who set this up. He's got an amazing skill set in digital branding, technology, e-commerce, and was able to build this in 72 hours. I couldn't have done that. And he runs CardMedic and does a phenomenal job. And then we've got a team around us. We've got an amazing team of volunteers. And this is a massive team effort, patients and public. We've worked with national charities and so on. So I think this is a multidisciplinary team effort from business, industry, patients, staff, clinicians, accelerators, and so on. And I think it's definitely opened up a whole new kind of side of the NHS that I never saw as a trainee, and a whole new part of my brain doing throughout this experience.
Nice, wonderful. You okay, Andrea? You're having some trouble?
I'm connected again, but it just emphasises the importance of communication.
Well, you're back now. And obviously we're a mental health platform predominantly. We're a directory of therapists, and that's what we do. We match people to therapists. And obviously what you both do, you come up against the many ways that mental health affects people all the time. I mean, do you have anything you'd like to share with how you would like to see advancements in the mental health industry in your sectors or more broadly?
So yeah, I think from my perspective, I see patients presenting with mental health challenges, whether that's when I did my jobs in the emergency department, I would see a lot of that. But also the impact on patients' mental health who've been through intensive care, whether that's for a short or a long admission, or patients having any operation. It's a very vulnerable and scary time for them. And then, of course, ranging from patients that present to primary care as well. Just being able to access the mental health support that you need at the time you need it, and in the right format, because certain therapies don't work for everybody. So having a bespoke, I think there's probably 2 key areas: having a bespoke service with a type of therapy that works for you, whether that's cognitive behavioral therapy or talking therapy, whatever that might be, is so important. And through that, ensuring that it's in a language and a format that that patient can understand. Whether they can't read, then they need their appointment letters, for example, being communicated in a certain way. If they don't have access to the internet, can they see someone in person as opposed to having a video call? Just it being made available in an accessible and equitable format for all patients, irrespective of their social determinants of health or their communication barriers. I think that's sort of one of the really key areas for improvement in mental health services. But also there's the waiting times as well. And I think everyone's doing their best. It's it's nobody's fault, but the waiting times are so long, particularly in child and adolescent mental health services. I think the times are huge. Long time for diagnoses, and a lot of it ends up with acute crises and patients being managed in an acute setting for short periods of time, just because of the lack of staff available, the lack of services and so on. And people can't often afford to pay for a private service, so they're waiting for NHS services, which ends up being, potentially not equitable for those people who are on long waiting lists. So I think access to services and providing them in an equitable way are really key for the industry and the specialty to really thrive in the long term.
Well, I think from working as a healthcare provider, we need to work in partnership effectively, and obviously there are a lot of challenges which we really need to sort of address really urgently to enable, because often people with mental health conditions end up being treated in an acute setting like University Hospitals Sussex, which isn't the right place for their treatment. So I think, as a system and all the parts that sort of effectively make the NHS work together, I think there's a lot more that we can do there. I think as well there's a real opportunity for innovators like Rachel to be able to, I was going to come up with exactly the same quote about necessity being the mother of invention. I think it sort of articulates exactly what Rachel did beautifully. So I think there is an opportunity for other innovators to really sort of look at things from a different perspective, perhaps, and so through innovation, through challenging the status quo, be able to deliver better care.
Great. Well, thank you so much both for your time, and congratulations again, Rachel and CardMedic. Very worthy winner. And it's been a pleasure.
Yes, really lovely chatting. Thank you. Thank you so much. And thank you for the opportunity. And I accept on behalf of the whole team who work tirelessly and the frontline NHS services who supports our patient population. I'm off to a night shift tonight, so I will be doing putting my other hat on, my clinical services hat on. So thank you so much for the opportunity. Really appreciate it. And thank you again, Andrea.
Thank you.
Thank you both. Take care.